So first of all, what exactly is it? Put together a brief timeline. In the very beginning, 1975 was the first book that was published about love addiction, actually by two men, Stanton Peele and Archie Brodsky. Love and addiction, this is how they would define it. An unstable state of being marked by a compulsion to deny all that you are or have been in favor of some new and ecstatic experience. So 1975 is the first time we really start to see that term, love addiction, at least in scholarly journals and also in popular culture. Brenda Schaefer in the 80s wrote a very famous book called Is It Love or Is It Addiction? Her definition would be, love addiction is any unhealthy attachment to people, euphoria, romance, or sex in an attempt to get needs met. Moving forward into the 90s, Charlotte Davis Castle. She wrote a number of books, including If the Buddha Dated, If the Buddha Got Married. She's done a lot of really amazing work and also wrote Women, Sex, and Addiction in the 90s. Her definition, sex addiction and sexual codependency have their roots in survival skills women adopt to cope with childhood wounds, neglect, abuse, loss, sexual shame, and negative sexual programming about being female. That last one is a very important point, and I'll be talking about that more in just a minute. Pia Mellody, Facing Love Addiction. She's probably the most well-known authority on love addiction. She wrote Facing Love Addiction. She's also teaches and I believe still provides therapy to clients at the Meadows, which is in Arizona. They have a very significant and well-respected love addiction program out there. A love addict is someone who is dependent on and meshed with and compulsively focused on taking care of another person. Next up, Kelly McDaniel. So Kelly's book, Ready to Heal, which is a book that I reference frequently in the workshop and working with clients who come to me for love addiction treatment. It's a great book. It's very easy to read. It's not particularly academic sounding, but it's filled with incredible information. I've probably read it 20 times now, and it's a slim volume, but I still continue to get a lot of information out of it. Kelly would say, sex and love addiction is not about either love or sex. It's a desperate search for connection, belonging, and love that gets distorted into control, fear, and shame. And then this definition, which is from the book Making Advances, which is an anthology edited by Alex Katahakis, who's the clinical director here. So it's, as the subtext says there, a comprehensive guide for treating female sex and love addicts. It's a great book. Her definition, sex and love addiction is best understood as a profound inability to bond with others. The pursuit of relationships or sex looks like a search and desire for intimacy, but in fact the pursuit and high of falling in love or having an orgasm takes the place of connection with a partner. So as you can see, there's a variety of definitions. Oftentimes it's self-defined when I work with women who are wondering, is that me? You know, there's no blood test for love addiction, so we have to use a variety of definitions and assessment tools or whatever. And is this model useful for you? Some people prefer to say I have really unhealthy relationship patterns. That's fine. Other people feel like, wow, this is a thing, and it can be treated, and there's a model for treatment, so they really resonate with the love addiction model. So that's just the lens that we're going to look at these behaviors through today, although there's a variety of different ways that you could look at some of the same presenting traits and symptoms. So there are many questions one could ask. These are probably the top questions that I ask clients, or they might ask themselves in a self-diagnosis test, is that, do you get high from romance, fantasy, or intrigue? So sometimes it doesn't even involve another person or a person that knows you're interested in them. Often it's just the fantasy of someone. Oftentimes there's no communication with the person. They see someone walk into a room and already they're really deep into fantasy about that person, and it becomes extremely painful. Changing relationships often, making sure the next one will be right, so kind of a compulsive entering in quickly and then deciding, no, this doesn't work, I got to find the right one. And as you'll see, that's often a mistake that therapists and other people can make, saying, oh, you just haven't found the right person. not realizing that, okay, this is really a pattern and it's really more about you than someone else. The feeling empty when you're alone, I have a whole slide about that, on the deep emptiness and the aloneness that love addicts feel. Stalking social media, which has become hugely problematic over the last, I would say, 5 years in particular, with the dating apps and just how pervasive that technology is, and didn't exist before even 10 years ago in the same way it does now, or certainly 20 or 30 years ago. Just wasn't. It's the rocket fuel for love addiction. That's what I like to call it. Social media. So do you frequently try to figure out what your partner is thinking? That's part of the obsessive thinking, really trying to get into the other person's head, feeling an instant closeness with someone you just met. And then the shame piece. That's often an important symptom to look at, is what's the level of shame and how you feel about your romantic or your sexual behaviors. And then are you using food or work, drugs, alcohol, kind of other addictive behaviors to cope with these shameful feelings? So that's just a little bit about love addiction. And then the next question I usually get is like, well, how does all of that differ from just plain old being in love? Because I'm sure if you've ever felt like you've been in love on some level, right, there's obsessive thinking. You can't stop thinking about that person. Maybe you did some things you shouldn't have done because you couldn't stop yourself. You can be in terrible heartbreak when it ends. A lot of the same symptoms can apply to that cycle as well. So for the answer to that question, I like to look to Helen Fisher. I don't know if you're familiar with her work, but Helen Fisher is a very well-known anthropologist and researcher on human behavior, particularly around sex and relationships. She's got a lot of great videos on YouTube, so if you Google her, you'll see her talking more in depth about this issue. But she would say that, romantic love, obsessive love, passionate love, whatever you call it, that men and women of every era and every culture have been, as she says, bewitched, bothered, and bewildered by this power. And that being in love is universal to humanity, or the longing for love. And it's part of human nature. So the question then becomes, how can we separate out what seems like kind of a healthy cycle of romantic love versus an addictive pattern? Helen would say that love addiction, when it's going well, is a lovely addiction to have, and then when it's going poorly, it's a terrible addiction to have. Anyway, you can check out some more of her work. She has a lot to say about that. So then we have to look at, okay, there's a lot of crossover in terms of how people feel in the level of obsessive thinking. So we have to look at, okay, how intense is that obsession and the preoccupation with the love object? Because again, it may be a real person, it may be a fantasy, it may be an ex. Could take all kinds of different shapes. So we're looking at obsession, that's the thinking part, right? Then we're looking at compulsion, that's the behavior part. Unable to control your behavior, so that sense of like, I didn't want to do that, I didn't want to text, I didn't want to sit in front of their house, right? I didn't want to do any of these things, I didn't want to have sex on the first date, I didn't want to do a lot of things, but I couldn't stop myself. And then looking at continuing those two things, the obsessive thinking and the compulsive behavior, despite a lot of negative consequences. So that's another key, that people are left feeling really ashamed generally about what's going on, and they feel it's negatively impacting that relationship, or maybe it's having a negative effect on just their own life. They're not sleeping, they're not eating, they can't go to work, they isolate. There's a lot of negative consequences that I see working with women who identify as love addicts. And then there's the tolerance. So more and more and more of the same to get the same high. Maybe it's more texting, maybe it's more phone calls, maybe it's more meeting men on dating apps, escalating that. There's usually, I'm not going to talk too much about the sexual component, but there's often a sexual component, either of sexual compulsivity, just a lot of sexual acting out, a high level of sexual activity, or sexual anorexia, just really isolating, never having sex, feeling maybe afraid of it. So those would be the 4 main hallmarks of addiction that you could look for. So to sum it up, love addiction is a repeated, compulsive seeking of a relationship or romantic experience despite the negative consequences. And that's a real difference between just romantic love, where generally you might feel obsessed and maybe do a couple things, but the outcome's often really positive and you feel really good about it and you're getting positive feedback from that. Okay, any questions so far? Yeah?
What's the difference between having an anxious attachment style versus being a love addict?
Well, that's a really good question, and I don't know if I have the time to answer that, but I would say people can have anxious attachments in all kinds of relationships, whether it's with coworkers, with family, right? So love addiction, that can show up in love addiction, but it's not the only defining factor. I would say that it's often a piece of it. Attachment style and having some version of an insecure attachment style definitely shows up in love addiction. Either it's anxious avoidant. You know, with attachment theory, there's always different, not everyone agrees on the attachment styles, I'll say that. Did you have a question?
I did.
Uh-huh.
I was wondering, can it be one obsession that they hold on to? Is that the same if a person, they're repeatedly different?
Well, I would say that oftentimes it's repeated in the same obsession. So, for example, people get stuck in toxic relationships, and even though that relationship physically may have ended, in the obsessive thinking, it just goes on and on and on, and they can't really break free of that. I find actually the obsessive thinking to be probably the most pervasive, the toughest piece of this, and the hardest thing to really treat, because people are doing it and you don't know. You can't tell by looking. Behaviors, people can get a handle on their behaviors. You know, they can absolutely say, okay, I'm not going to date anyone, or I'm not going to have sex on the first date, or I'm going to limit my texting. It's a concrete behavior. With thinking and obsessive thoughts, it's a lot more difficult. But yes, it could be an obsession that lasts years.
Are you using love and sex interchangeably? Because I feel like in some of the sentences it says love addiction, and sometimes it's sex addiction. So are we talking about two separate?
Yes, so I'm talking about love addiction, which is primarily relational, right? And it can involve sex, but it doesn't have to. Okay.
So friendships?
It could be a friendship, right? You could be love addicted to someone who you've never had sex with, never been sexual with, and you could still have the obsessive thinking, compulsive behavior around that. Or it could involve some level of sexual interaction that also doesn't feel good to you. So, you know, it's on a continuum, right?
A lot of overlap between love addiction and sex addiction.
Right. I would say that people, it's really identified, and people either identify as like, wow, my sexual acting out is primarily the biggest problem for me, or it's my obsessive thinking and my quality of relationships that's the biggest issue for me. And some people, you know, can't differentiate between the two, and it's a mix of both of them. But today I'm going to be primarily talking about the love addiction part of it, and for people who identify primarily as love addict and that they see really unhealthy patterns in their romantic relationships. All right, so here would be some common traits. It's not an exhaustive list, but I think it's a good summary of what people feel. So obsessive thinking and repetitive analysis, always trying to figure out, should I do this, should I do that? A lot of thinking about the situation, a lot of fantasy about the situation. Love addicts often attach an all or nothing meaning to another person's words or action. So always trying to figure out, did he mean this? Did he mean that? What does she mean by this? What does that say? He looked at me, she went here. You know, really trying to attach what that means. They love me, they don't love me. They're into me, they're not that into me. In a really black and white sort of way. Compulsively connecting and disconnecting in relationships. So getting in really fast and then feeling like maybe you need to get out really fast. That tends to happen more on the love avoidant end of the spectrum, which I will be talking about, because we can't talk about love addiction without avoidance, because people really slide back and forth to being all in and maybe super needy and clingy to like, I gotta get out of here on the other end of the scale. Intense fantasy. It's really a hallmark of love addiction, and oftentimes it starts in ways that people don't even understand. They're fantasizing just when they're getting dressed, thinking in the back of their mind, oh, when they see me in this outfit, or when I walk into this room, or great, I'm going to work out because I really need more exercise, but really it's because how this person's going to think of me and how they're going to look at me. And so getting to that level of being able to discuss fantasy with clients, it takes a while to get there. Denying reality, having distorted thinking, making poor decisions based on that distorted thinking, really easy to collapse boundaries, good at setting boundaries, oftentimes really good at knowing what they want to do, and then a really difficult time being able to do it, like so many of us, of course. Choosing unavailable or dangerous people to pair up with, a pattern of rescuing or fixing other people, being in a one-up, one-down dynamic, which is oftentimes so much an internal process, looking around and thinking, I'm prettier, you're not as beautiful, they really like me, everyone hates me, really a lot of up and down dynamics like that, one up, one down. And then this sense of perfectionism, which is really not about being your best self and wanting to give it everything you've got, but really about being seen as by other people and how you look in other people's eyes and the kind of validation you need, as we all need validation, right? We all need that, but it's about looking at this in its sense that it becomes harmful and it doesn't feel good. So if we look at some 4 core beliefs that are really common to all addicts, these are beliefs that I pulled from Dr. Patrick Carnes, who's a pioneer in sex addiction research, and Kelly McDaniel then, what's the word I'm looking for, applied them to female love addiction. So she made a couple of changes in the language. But number 1, I think that stands, which is I'm a bad and unworthy person. So I've noticed in my work, certainly with sex and love addicts, and also just with addicts in general, that number 1, that core belief is it's always present. And then the second one, nobody would love me as I am. If I have to rely on other people to meet my needs, they won't be met. But then, of course, number 4, that for love addicts, a romantic relationship is my most important need or my most important sign of love or maybe my most terrifying need. So you could see the double bind gets set up. I have to rely on other people, but yet I can't rely on other people. But I long to be in a relationship, but I can't trust anybody. So that's how people feel so stuck. So we have these 4 core beliefs. Then moving into these 4 cultural beliefs, and these are specific to women. These are specific to female love addicts. And there's more in Ready to Heal, Kelly McDaniel's book, if you want to dive into this. I'll just give you the brief overview. I must be good in order to be loved. Everything about being a good girl and what it means to all of us and families of origin and cultures we grew up with, what that definition is. I must be good to be loved. If I'm sexual, though, I'm bad. So we still see that today, alive and well, with slut-shaming and all kinds of sex-negative messages in the culture, even for people who consciously, intellectually reject all of that. Emotionally, there's often a piece that's in there that feels that if I'm sexual, I'm bad. I'm not really a woman unless someone desires me sexually or romantically, but then I must be sexual to be lovable. So again, it's a setup for a double bind. There's no way out of this if you are stuck in these 4 core beliefs. And so a big part of my work and work in general dealing with female love addicts is to first identify these beliefs and then deconstruct them in therapy. So we're going to move into now what the cycles are for love addiction and love avoidance. And so once you've identified the core beliefs and some of the traits, you can look at how the cycle repeats itself. And this is the idea that so many addicts are looking for, whether it's drugs or alcohol or sex or love, is that something out there is going to fill this hole inside. And that's why the cycle keeps repeating. So of course, the real work is how can you give that to yourself, right? It's self-love, it's self-compassion. It's really an inside job, as I like to say, healing love addiction. So the powerful cycle of addiction. So of course, I've identified these negative beliefs, the core beliefs, the cultural beliefs that create shame. Shame fuels the addiction because we want to escape from shame. We want something to take the edge off. We want to feel better. It's so painful to be in that place. So the addiction is the escape from those unbearable thoughts and feelings. And yet every time we act out and engage in all these addictive behaviors, and those are addictive behaviors that would be self-defined, that the client would say, right, these are the things for me that aren't working, that I don't want to do anymore, that make me feel bad about myself. And yet they do, right, it's a way to escape and get a moment of relief from this pain, but it only serves to strengthen the negative beliefs that I'm not here I go again in this cycle. I'm doing it again. I'm a terrible person. Who will ever love me? What's wrong with me? I feel broken. These are the things, these are the phrases that I hear over and over again from the women that I work with. And my response to that is always that there's nothing broken. This is an opportunity for you to really know yourself more deeply. There are parts of you that you don't really know, maybe parts of yourself that you don't really want to look at, parts of yourself that you wish you could just cut away with a pair of scissors because you just hate that part of yourself. And this work is really about shining a light on that and getting to know those parts of yourself and getting to know yourself more deeply at any age and at any stage of relationship. 5 criteria for an addictive relationship. So this, again, comes from Charlotte Castle's work. Powerlessness to stop. I tried to stop, but I couldn't. I said I wouldn't do these things, but I did. I didn't want to do it, but I did. That's that sense of powerlessness. Harmful consequences, either to yourself or to the relationship. Unmanageability in other areas of life. So things are really starting to fall apart. I can't keep it together. I can't pay my bills. I'm not taking, self-care is often the first thing to really go down the drain. I'm not showering, I'm not eating right. All kinds of unmanageability in other areas of life. Escalation of involvement, increasing obsession, so I'm going to turn things up. I'm going to feel like I'm going to do more and harder of what is not working to try to get out of this cycle. And then, if you finally decide to take a break, okay, I'm done, I'm walking away, the pain is so unbearable that you either have to go back to it or get into some sort of treatment to really interrupt that cycle, or start something up with somebody else. Those would be probably the top 3 options. Okay. So if you look at love addiction, what they tend to do is assign a disproportionate amount of time and attention and value above themselves to the person that they're addicted. So often they're in the one down position, right? This person's, in a sense, so much better than I am in so many ways. And they're going to heal me and they're going to rescue me. And this is what's going to fix me. Having unrealistic expectations for unconditional positive regard. So this often shows up in a sense of, I want them to say only kind and wonderful things about me all the time. I really need that. But the minute there's a perceived criticism, I can't, it's unbearable to me. Neglect to care for themselves or value themselves while they're in relationship. And I always point out to women that every time you eat good food, get exercise, get enough sleep, take care of your financial situation, even in small little ways, that is telling yourself it's a counter message that you matter, that you have value. It's not only just taking a bubble bath or getting your nails done or things like that, which are lovely ways to take care of yourself, but it shows up when you know that I have to show up for myself because no one else is going to do it for me in some situations where it feels really difficult. Again, more symptoms of love addiction. We've gone over some of these things. Inability to trust in relationship, really unable to stop seeing a specific person, even though that person is destructive. Really difficult time being alone and intense loneliness, feeling like love has no or little meaning without relationship, flirting or sexualizing someone even if you don't mean to. So I often hear from women that they want to attract attention from another person, even if they don't really like that person. They're not really turned on by that person, but they just really need that attention, and they don't understand why they're doing that. This is what I've come to title the dark pink triangle. This is a triangle of my own invention. The 3 things that I think show up that are the most difficult for me to deal with as a clinician is to hear about women's depth of loneliness, to hear about their hopelessness, and to help them manage their anger. So the loneliness, it shows up as very tearful many times, just this depth of loneliness. They feel so alone in the world, and when is that going to change? Sometimes women are very isolated. Sometimes they don't have a lot of social connection. They feel very separate from people. Other times women have a lot of social connections. They have a lot of friendships with women. They're very busy, and yet at the end of the day they come home and they can still feel this deep sense of loneliness. And when you're present with that in the room, it's very painful to observe. And there's no easy answer. I can never tell a client, well, here's the end date to the loneliness, or here's how we're going to stop it. Or there's often a belief that if I only was in a relationship, then I wouldn't be lonely anymore and I would never feel this. And so gently, I often try to remind them or help shift their perspective that even in relationship, there's loneliness. Even in relationship, there's loneliness. So that's not the silver bullet for that. It's an ongoing, deeper process of many things to really help deal with that piece. The hopelessness, again, is very difficult to face in the room. It's a lot about when am I going to meet somebody. I feel like I'm never going to meet somebody. It's never going to happen. It's never going to happen. Many of the women I've worked with have been in programs before, they've gone to see dating coaches, they've been in therapy for many, many years, they've taken lots of workshops, they've done a tremendous amount of work on themselves, and they feel like, and it still hasn't happened, and when is it going to happen? So that's a very difficult question for me to answer, and again, I can't give them an answer except to say that I take a very spiritual and philosophical approach to that answer, which is, we don't know what's going to happen today. We don't know what's going to happen tomorrow. Nobody knows what's going to happen next. And life is really mysterious, and sometimes that's beautiful, and sometimes it's incredibly painful and cruel. And this is really a process of learning to cope with that in a way where you feel like you can really raise the floor on that level of hopelessness. Maybe not go as deep, stay as long, have it be as painful. Then there's the anger piece, which is also another intense emotion. It's very prevalent in female love addicts. They have a lot of anger. Sometimes people aren't in touch with that anger. I rarely get people who say, I don't feel anger, I never feel angry, can't feel anger. It's more rare. Mostly they're very angry, a lot of people, and it often negatively impacts their relationship because a potential partner will do or say something that's perceived as a slight, and then there's a lot of passive-aggressive activity around that, and then they push people away. So there's a lot of work in therapy, of course, with anger, but specifically around the love addiction piece. So if you look in Pia Melody's book, Facing Love Addiction, that's where I pull this information from. That's where the cycle of the love addict is. It's a 9-point cycle where you're really attracted, you feel all high, it's such a relief from the pain and loneliness, and then all of a sudden you become more and more needy, you're not getting your needs met, making up excuses for that other person. Well, they're busy, well, they said they didn't really want a relationship. I'm okay with that, but not really. And so it's denial of what the other person's boundaries are, what that other person might be saying, and then finally when you develop the awareness of that and then denial crumbles, it's extremely painful, entering in withdrawal. Withdrawal is so painful, there's a lot of obsession about how to get that other person back or how to get even, a lot of villainizing of the other person, and of course, when I'm sitting in a room with a client who identifies as a love addict, of course I'm only getting one side of the story. There's many sides of the story. So I'm very careful not to villainize the other person. Obviously, if it's an abusive relationship, if there's signs of physical or emotional sexual violence, I have to address that. But I'm always really careful to bring it back to what's going on for you and looking at people's level of responsibility in these relationships. Because obsession is about what's happening out there. When you stop obsessing, you really have to look at your own stuff and what's going on inside of you. So often compulsively acting out these obsessive plans, and then again, you're just going to repeat the same cycle with either the same partner or a new partner, or you're going to intervene on that cycle and do something different and get into recovery. So next, love avoidance. They're showing up more and more in my workshops and in the work I do here. And I think there's just more messaging out in the culture now about this end of the spectrum, especially for women. So they tend to evade intimacy in the relationship by creating intensity outside. Usually they're very busy, they tend to make the most amount of money, they have a high-powered job, sometimes they can be addicts as well. There's just a lot of things going on outside of the relationship. They avoid being known in order to protect themselves from feeling engulfed. So love avoidants technically have grown up in families where they were enmeshed, where they were parentified, and so while they long for intimacy, they also feel like they're just going to be suffocated. So they're often quick to get in and then start backing out, picking apart the other person. It's a lot of different traits that they have. avoiding intimate contact with their partners using a variety of distancing techniques. Love avoidants typically come on strong, then they back off. They can use a wall of silence and keep talking to a minimum, or alternately, they could talk a lot and sort of have this wall of words and really not be talking about very much. Helps to reduce some of the anxiety. They can show up in different ways, but the idea is that you're putting a wall between you and the other person, not really letting them in. Often very nice instead of being authentic. Controlling money, being busy, always being right. Either always arguing to be right or never arguing because you don't want to make any mistakes. Again, love avoidants often feel like they themselves are not worth loving. They're really not lovable. They're, I guess as John Bradshaw would say, they feel like they're human doings, not human beings. So their worth comes from taking care of other people. They believe that taking care of needy people is their job, entering into relationships out of duty and to avoid guilt, but not because they're really in love. And then always this fear of, well, that should be number 3. Getting close to someone means I'll be suffocated and controlled, so I want to avoid closeness. But so on the surface, love avoidants feel like I want to avoid intimacy, but underneath, on a more unconscious level, also want to avoid abandonment. Love addicts, on the surface, don't want to be abandoned, don't leave me, but underneath, really have trouble with intimacy. Yeah?
It sounds similar to like the commitment phobic. So somebody that, engages in a relationship and as soon as there's some sort of commitment, whether that's a label on their relationship
Sure.
or
Yes.
they start backing off and self-sabotaging.
These are the people that are typically considered unavailable in relationships. They seem, and yet they pursue relationships, but then also feel like I'm unavailable. So it's that mixed message. This would be the cycle, also coming from Pia Melody's work, the cycle of the love avoidant, entering a relationship because you feel guilty or you just didn't want to say no. Well, they were so nice and they really like me, and I should just try this. I always seem to pick the wrong people, so maybe I'll just give this person a shot. Often shows up with a wall of seduction, sort of their power and their fanciness, and here's all the things I have going for me that make the other person attracted. But then quickly overwhelmed by the other person's neediness, and this piece of getting critical and resentful right away. I see that pattern of I really like this person for the first couple of weeks, and then all of a sudden I really started to pick them apart. Their hair, their clothes, their job, what they said, who they hang out with. And then there's also always this feeling inside of like, why am I doing this? It feels really bad to do that. I can't stop myself. Often feeling victimized by a partner's demands. It's just too much. So you just start putting in space and finding other ways outside of that relationship to feel alive. And yet when that person moves too far away, when they're finally like, okay, I'm done with you, then, oh, don't go. That's the don't leave me, that's the don't abandon me piece of the avoidant. Because if avoidants were so avoidant, they might just say, okay, fine, go and be okay with that. But when the other person puts too much distance in between, it's a cycle of moving in. With the same partner, a different partner. So that's a little bit about love addicts, love avoidance. I want to spend some time really addressing what I see as the most critical piece of love addiction. And again, as I said, the hardest to treat, the most pervasive is this obsessive thinking. Obsessive thinking. And sometimes people don't even know the level of obsessive thinking they're doing because they don't even track it. So once we really start tracking it, people are like, whoa, wow, that's happening a lot. So an important piece to remember about obsession is that when we're obsessed about the other person, we're really losing so much of ourselves. It's a way to manage anxiety. It's a way to manage all kinds of feelings, loneliness. We always have to ask what's underneath this obsessive thinking. If you weren't obsessed about this other person right now, what would you be thinking about? What would you be feeling? What would be going on for you? So underneath that, a variety of emotions, usually anger, loneliness, hopelessness, despair. Relational obsessions really allow us to avoid identifying and feeling our most painful emotions. So it's in some ways a fabulous defense because we're protecting ourselves from that. But we're also ignoring our own needs and really not grounded in reality about what's really happening. It's also a way to control the outcome. which is a codependent flavor to it. There's a lot of codependent flavor in love addiction and love avoidance. It's a way to externalize the problem, and also really mistaking intensity for intimacy. So it's like spending a lot of time with one person, hours and hours, texting back and forth. Oh, we shared so much in a small block of time. It feels like I really know them or they know me. But it's really the high and the intensity, when really intimacy takes some time, and really takes time to let people in, right? Intimacy, into me, see. To really let someone see into you, and to do the same for the other person, right? Healthy intimacy. I wish I thought of that, into me, see myself, but I didn't. So now moving into treatment planning. So I'm assuming that many of you in this room are therapists? Yeah? Okay. So the first thing you can do is look at, the hallmarks of addiction. You could look at that's not on here, but you should do that. Look at the hallmarks of addiction, and then look at those 5 criteria of addictive relationships as a way to assess, right? What's going on here? Is this someone who's just depressed? Is this a bad breakup? Or is there really a pattern of harmful addictive behaviors that we can get in and intervene on and interrupt? Then you want to look for co-occurring addictions. The majority of women that I work with tend to be in recovery from drugs and alcohol. They often are in some level of recovery or need to be around disordered eating. They may or may not have sex and or porn, some problematic behaviors around that. Shopping would be another thing that shows up, or around finances. So always want to look for that. Oftentimes people have done the work on their drug and alcohol recovery, they've gotten their eating under control, and now they're left with this piece. And again, that's part of the sadness and anger and despair, because they feel like they've done so much work and now this, what's going on? And I like to remind them that when you pull back those layers of all those other ways that maybe you were medicating yourself or not really allowing yourself to feel some of these feelings, this is what shows up. It's important to take a detailed sex and relationship history, and you could do that pretty quickly in the first couple of sessions. Just feel comfortable talking about sex, talking about relationships, want to kind of get some bullet points, moving kind of quickly from like first relationship, to how many long-term relationships have you had. Some people have had none, some people have had multiple relationships, and just listening for what really stands out to you as some sort of pattern that you can identify. Then you would want to move into looking at the early relational trauma, which is abandonment, rejection, enmeshment. And again, this is something that can be done fairly quickly in the first couple of sessions. You don't need to do an extensive family of origin intake, but really getting a sense of what was your mom like, what was your relationship with her, what was your relationship with dad like, what did your mom, was she affectionate with you? Kind of looking for that, or whoever the primary caretaker was, right? Was there some form of neglect? Oftentimes it shows up as benign neglect. These children who are raised in homes where, money's not an issue and people are around to take care of them, but really had no attunement. In Kelly McDaniel's book, Ready to Heal, there's a whole chapter called Mother Hunger. And a big part of her work is really identifying this trauma between women and their moms that happened at a very early age, and still decades later feeling like that hasn't been healed. And there's so much pain from that. So you want to get a sense of what happened early on. Sometimes it shows up and it's obvious, sometimes it's not. Looking for sexual trauma, of course, those would be the pieces that you'd want to have outlined so that you could work with that. You can also ask a client to take the love addiction screening test. We have that on our CHS website. And again, it's a 25-question self-diagnosis. Anyone could answer yes to many of those questions at any time. So again, it's just an assessment tool. Depending on where someone is at, if they're in the middle of a bad breakup, they might answer yes to a lot of things, or in just an obsessive relationship that might just be a one-time thing. So you just want to be careful with that. You could also refer them to SLAA, which is Sex and Love Addicts Anonymous. They have a 40-question self-diagnosis test. People often like to take tests, so something, a way for them to just get reflective on their behavior. And again, looking at assessing for love addiction, but also love avoidance, the sexual anorexia, and the sexual compulsivity on a continuum, because oftentimes women will be very addicted in one relationship, and then in the next relationship be really avoidant. And sometimes even in the same relationship slide from being really more on an addicted end of the continuum and then more to an avoidant end of the continuum. So they're not concrete, discrete states. People slide around a lot. So to be aware of that is important. Treatment planning. So treatment planning is, when you use an addiction model, the first thing you want to do before you get into more deeper trauma work or deeper psychotherapy is you really want to get a handle on the behaviors and the thinking. So first you want to identify the problematic behaviors and implement any behavioral changes. So if someone is really engaged in some risky behavior, then you really want to first address that and set some limits around that. Are they willing to no longer do that anymore? Are they willing to abstain from that? If not, can you reduce the amount of time you do that? Whatever it might be, and those are often self-identified, whatever compulsive, harmful, addictive behaviors someone's engaged in, safety first. So you want to look at that first. Then the next step in love addiction would be to try to interrupt the negative thought patterns and interrupt the obsession. And that's difficult to do. But once people realize through mindfulness, I use some DBT, meditation, so the variety of techniques that people can do to catch themselves, stop themselves when they're in an obsessive thought, and then recognize that, and then shift their focus and energy to something else. So it becomes a practice. And sometimes women can only get a few seconds of that. It's like, I was really obsessing, I couldn't stop thinking about so-and-so. All right, well, it takes a conscious effort to literally move your focus and energy over there, even if it's only for a few seconds, 15 seconds, then you have minutes, then you get better at that. So there's a lot of interventions you can use and have to stay on it. Of course, improving coping skills, a lot of this is emotional dysregulation and affect dysregulation, so all sorts of ways that you could teach a client to have better coping skills. Very useful here as well. Introducing 12-step. For many women, it's very helpful for them to go to SLAA, which is Sex and Love Addicts Anonymous. There's many meetings around Los Angeles, free all the time. People have mixed experiences with that, but it's definitely something that I recommend for women, and for some people it really is very, very effective, really effective. They can also go to Codependence Anonymous. They could also go to Al-Anon. A lot of recovery in the rooms at Al-Anon, which is often why it's recommended, is similar things, similar traits of codependency that we're dealing with in love addiction, and so maybe they find some sense of community with people in Al-Anon, so you could try that. Group therapy is excellent intervention because they get feedback from other people, particularly women if they're in we run the women's intimacy group here on Thursday nights. We're dealing with a lot of intimacy issues, not everyone has to identify as a love addict. In our Thursday night group, you could just feel like I'm struggling with any aspect of romantic relationships. But getting the feedback of how other people perceive you and being able to take some of that criticism in and work on that, as it happens in any good process group, but specifically around romantic relationships and sexuality. You may need to suggest some inpatient treatment. That's usually very expensive. Not everyone can afford to go to the Meadows or some other inpatient treatment centers, but if they can be very helpful. We also have an intensive treatment here. We do an 11-day women's intensive treatment program, as well as just the 3-day workshop. But the 11-day is really an intensive program. We want to be providing psychoeducation on healthy intimacy and sexuality. There's books you can give them to read and homework. And daily check-ins. Sometimes I ask clients to just write down every day what their obsessive thoughts were, how long they did it. You can tailor it to every client, and doing it every day really gives them a window into what exactly is going on for them and holds them accountable for what's happening, because a lot of the obsessive thinking can just feel like I don't have any handle on how long I've been doing it or when I stop and start. Once you move through some of the basic treatment, then it's time to get into deeper work, which would be the trauma treatment. Every person I've met who's come to me for love addiction, there's always trauma, and at its root really needs to be treated with a variety of techniques. Experiencing or any somatic therapy is probably my favorite type to use because you're really about moving out of your head and into your body. And for people who are stuck in obsessive thinking, you want to get more into your body. It's one of the things I work on with clients all the time is what are you feeling? What do you notice when you're talking to me about that? What's happening in your body? Oh, my jaw feels tight. Moving down, getting out of your head and into your body is really important in terms of healing this. That's the learning to track somatic cues piece. In my workshop, something I just talk about constantly, really getting women to check back into their body. What are they noticing? Maybe you notice nothing. Maybe you feel numb. Maybe you don't feel anything at all. But it's about reconnecting that, right? So we want to move from dissociation to association. We want to be reconnected and grounded with ourselves, our core center. Increasing connection to female friends. Some female love addicts have a strong social network. Others do not get along well with women at all and don't have a lot of female friends. So that's another resource that you really want to build for them. And even if it's just one person, being able to practice healthy intimacy is important wherever you find it. That's why the group work is so important. It's not about me just giving you important insights or giving you knowledge about intimacy. It's about feeling it in the room. And so I'm always telling people, wherever you have an opportunity to be authentic, to identify how you feel and what you need, first within yourself, and then communicate it with someone else, that's the work of intimacy. And wherever you can do that with anybody, it all flows into the same river of romantic relationships. And the better you can get at that with people, the better you will be at it when you meet someone that you're really attracted to and you want to have a relationship with. So there's lots of opportunities to practice, even if you're not in a relationship. Plenty of opportunities to practice healthy intimacy. That's a really important piece of doing this work. Self-compassion is huge. If we go back to that core belief of I'm nothing, I am worthless, it is so profound. And so we have to counter that with a different message. And sometimes people know intellectually, well, I know I also feel good about myself. But to really know it, to really embody it, requires a practice of self-compassion. And I really lean heavily on the work of Kristen Neff for self-compassion, for meditation exercises. She's got a great book about self-compassion. And it's one of those things that's really simple but not easy. Because when women say, we practice sometimes saying out loud, I am enough, or I accept myself exactly as I am, it is so difficult for women to really believe that and feel that. They think, but I can't, and I'm not enough. I can't really believe that. I can believe that about other people, but I can't believe it about myself. So that's a core piece of shifting this the core negative belief and the negative thinking, and really healing from the addiction. Mindfulness and meditation, very useful. Breath work, even in really small doses. I know that's sometimes really difficult for people. Their ideas about what meditation is or breathing, but even if you could take one breath, where you just say to yourself silently, I'm breathing in, and now I'm breathing out. You have freed yourself from obsessive thinking for those few seconds. And then you practice that a little bit more and a little bit more, and you get better at it. Self-care is a big part of it. Developing healthy dating plans. That's when people feel like they have some understanding about themselves and their addiction and what's going on, and maybe they've taken some time and they've got out of relationships and they've gotten a better handle on their behaviors, and they've really been able, you really want to concretely measure this progress, okay, right? You're doing better. You don't obsess as much anymore. You're not engaged in these harmful behaviors. And then here's the tricky part. So when you have no contact, and you can do like 90 days no contact, or you can just be out of relationship, then people feel pretty good. This is where the rubber meets the road, when they try to step back into a relationship only to discover that so many of those things are still there. Okay, so it's about holding them, being a great container, guiding them gently through this, because you have to practice all of the tools that you've learned. That's really such a critical piece of it. And a lot of times where people just go off the rails or give up or feel like, oh, it's back. But it's really about that you just haven't practiced. And you're just really learning how to do something different. And you didn't know how to do this before. You were doing it some other way. Now you're going to learn a new way of doing it. So really framing it in a positive frame, I think, is very helpful. And that's the practice of daily intimacy. Grab it wherever you can find it. Practice with whoever you can. Benefits to stopping addictive behavior. Improved intuitive decision making. That's the trusting your gut. That's about tracking your somatic cues. Really trusting that, because a lot of people, their mind will tell them anything. Make up any reason why they should do what they do, but in here, not so much. So you're increasing your trust, greater responsibility for your own happiness and your sense of spirituality, less loneliness, very key, less shame and perfectionism, and really being able to experience what real intimacy is, and often in the context of a sexual experience. So those are the tremendous benefits to doing this work. Again, here are the books that I mentioned. Here's my workshop coming up in September, and then the intimacy group on Thursday night. So, thank you. Let's go.
Question
Yeah.
about avoidance.
Okay.
I'm wondering, does the characteristic of somebody being attached to another person for their outside qualities, in other words, making a list of saying, I really like you because you're fun and you're athletic and but not being able to bond, is that kind of a sort of a characteristic of an avoidant?
Well, I think avoidant people they long to connect. There's a longing to get in there. And of course, I think lots of people make lists about, well, what's my ideal partner going to look like? I think there's a certain amount of rigidity in avoidance, where it's like, well, if you're not this and that, and this is what I need, then you're not right for me. I think there's a certain amount of flexibility in healthy intimacy. So maybe I would look at that piece, not so much the list making, but what does it feel like when you don't, when you don't get what's on your list?
Okay.
Exactly. What's the feeling that comes up? Does it make you want to move forward anyway, or do you feel like, okay, no, I got to back away?
Okay.
So.
So, one book to recommend, because there's lots, but
Oh, gosh, one book. It's really between Facing Love Addiction or Ready to Heal. I would say one of those two books probably would be top choice. Making Advances is great. It's more clinical and scholarly, really more for treatment, more for clinicians, yes.
thank you.
Okay. All right, anyone else? No? All right, you're welcome. Have a lovely afternoon. Thank you so much for being here.
So